In this video, we will start with some key healthcare finance terminology. This will help us understand the relationship between receiving healthcare and payment. Benefits are the services that an individual or consumer can receive as part of their insurance coverage. A premium is the amount charged by the insurer to cover the anticipated level of risk for medical care. Cost sharing is the division between the part of the premium the employer pays and the part the individual pays. The individual shares the cost of the premium and a part of the actual cost of care in the form of deductible and copay. The deductible is the amount the individual pays each year before the health insurance plan pays for the service. The copay is the amount the individual pays each time they receive a service. The insurer determines the benefit package the covered individual can receive. This includes how and where the individual gets healthcare services. The benefit package identifies what the premium and copay structure will be. Now that we have the key terms identified and how the insurance function works, let's look at the role of the healthcare claim. The insurance company or government payer processes claims and pays the providers. The claim form, also referred to as an encounter, is the primary method used by providers to reflect the service rendered. The form includes demographic data about the individual, such as age, gender, and address. It also includes clinical data, such as the diagnosis, procedures, physician services, and/or medical equipment. The services use specific code sets. The form also includes the financial charges for each service and the location of where the service occurred. Providers use the standard code sets, CPT, ICD-10, on the claim form to describe the type of service the individual received, for example, physical therapy or a hospital admission. Standard codes are used instead of words to describe the healthcare service, which makes the information consistent across all providers. Insurers and providers also use technology in the submission and processing of claims. The technology allows for electronic transfer of the standard codes for billing. It facilitates the application of business rules to make sure the claim is paid accurately and consistently. While processing the claim, the information from the standard code set helps the insurer complete several actions. First, to know what healthcare service the individual received, and next is the location of where the individual received the service, such as an ambulatory care center or a home visit. These two pieces of information are used to make sure the healthcare service is a covered service under the individual's healthcare coverage. These items also help determine the cost of the service. Every service has a payment associated with it, and the payment can vary depending on where the individual received the service. The provider is paid according to a fee schedule that has been established by the regulatory agency for Centers of Medicare and Medicaid, or CMS, and negotiated by the insurance company. The insurance company may negotiate the fee schedule to pay more than the CMS recommendation if there is a need. For example, a rural area where there is a lack of providers, the insurer may pay providers at a higher rate. This higher fee makes sure that providers are available to treat patients. Based on the fee schedule and total amount of money the individual has already paid for healthcare to date, which is the deductible, the insurer can determine the cost share between the insurance company and the individual. Beyond the payment function, the claim form is also the primary source of healthcare data used for many other healthcare operations. The use of standardized code sets, such as CPT, ICD, HCPCS, provides a consistent data flow. It allows the data interpretation across many functions and stakeholders in healthcare. The financial data on the claim captures cost and utilization for specific providers as well as total trends. The demographic data provides insights into the role of population and geographic demographics on healthcare services. We collect data and analyze it for many purposes in healthcare operations. We use data application for benefit design and future pricing of healthcare. Data on quality of providers impacts cost of care. These data aspects play a key role in financing healthcare.